Hello, my name is India Leach, and thank you for watching my antecedent prompting presentation. Intro to Autism. Autism includes the following impaired characteristics: social communication, which is the language that is used in social situations; restrictive, repetitive patterns of activity and interest, including rocking back and forth, flapping hands, flicking hands, snapping fingers, walking on toes, repeating words, and repetitive blinking. And it is often accompanied by sensory sensitivity, medical issues including GI, seizures, sleep disorders, mental health issues including anxiety, depression, as well as attention challenges. An estimated 1 in 54 children in the United States today are diagnosed with autism. It is influenced by a combination of genetic and environmental factors. Individuals with autism have a distinct set of skills and challenges. Abilities and skills range from highly skilled to severely challenged, resulting in significant support, moderate or little to no support to live semi-independently or entirely independently. Intro to prompting. Such characteristics may cause an individual to struggle with behavior, social interactions, skill acquisition, as well as the ability to receive adequate reinforcements from the daily activities of life and learning. Therefore, the use of prompting procedures provides beneficial when teaching those with ASD, as it helps remediate the difficulties of the restrictive characteristics commonly observed in students with ASD. Research indicates such prompting procedures help support and improve meaningful practice for problem solving, creativity, as well as necessary skills to effectively communicate with those around them, both socially and emotionally. Prompting. Prompting is a means to introduce an individual with added stimuli, prompts to include a desired behavior. Prompting is provided when an ordinary antecedent is insufficient and excessively used in behavior shaping as well as acquisition. It provides learners with assistance to increase the probability that a desired behavior will occur. Successful performance of a desired behavior elicits positive reinforcements, therefore reinforcing learning. A prompt like a cue or support to enforce a desired behavior that otherwise does not occur. How to use. Prompting varies from most to least intrusive. Prompting should be faded to avoid prompting dependency. Steps in prompting. 1. Identify the least intrusive prompt. Choose a prompt that is necessary for the correct response to occur. 2. Give differential reinforcements. Offer a correct response. Give appropriate reinforcements that is equivalent to the level of performance and dependency. 2. Fade prompt. After the child masters a skill, gradually move prompt away or replace it with intrusive prompt. When to use. Prompting is effective with children and youth diagnosed with autism, regardless of their cognitive level and or expressive communication abilities across an age range. Research indicates prompting procedures and strategies are effective and efficient for the use and interventions for learners with autism spectrum disorder and for students at various ages from toddler to adulthood, or roughly 2 to 22 years of age. Prompting also includes meaningful supports in a variety of settings to include the student's home, school, and within the community setting. Social behavior should be related to an array of settings and social opportunities available to individuals with autism, which include friendships, work, leisure, family, school, and other casual social contacts. Variations include full physical. The teacher uses hand-over-hand supports to aid the child in completing a task. Partial physical. The teacher provides partial physical assistance to help the child complete a task. Full model. The teacher models the desired behavior. Partial model. The teacher models only part of the desired behavior. Full verbal prompts. The teacher verbally models the desired behavior. Partial verbal model. The teacher verbally models only a part of the desired behavior. Gestural prompts. The teacher utilizes a physical gesture or encourages the desired behavior. Positional prompt. The teacher places the target item in a location that is closer to the child. Time delay and prompt delay. When teaching a novel task, time delay is used to transfer the stimulus control from a controlling prompt to a natural prompt by placing varying amounts of time between a controlling prompt and a natural prompt. Not all prompts in the hierarchy need to be used when teaching a skill. Prompts should be chosen based on which ones are most effective for a particular child. Prompts should be faded systematically and as quickly as possible as to avoid prompt dependency. Overall, the goal of using prompts is to help the child independently perform the desired behavior. Situations and examples. I have several examples and I'll just read them to you. Josh was learning to match objects with names. The teacher started with verbal gestural prompts. She said, "It is time to draw, and we need some crayons to draw with." She looked at the crayons on the table and pointed to them, saying, "These are crayons." Then she pointed at the crayons and asked Josh, "What are these?" After Josh responded, "Crayons," the teacher nodded her head and said, "These are crayons. Great job, Josh." To fade prompts, the teacher gradually moved from verbal and gestural prompts to only positional prompts. For example, the next time the teacher placed the crayons on the table near Josh, she said, "We need some crayons to draw with. Josh, show me the crayons." Josh pointed to the crayons correctly and received a point on his token board. Another example of prompting includes, Miss Mendez found her student with autism excel in completing puzzles, and they seem to enjoy sequencing tasks. She facilitated interacting among those students and their general education peers by having them complete an alphabet floor puzzle together. Prompting the students with autism to request the next letter in the sequence or respond to peers' questions such as, "What is next?" enhance their communication with peers, as demonstrated by the number of responses given and the duration of shared attention to the task. Paths to prompting and social development. Direct instruction or relevant social behaviors. Relies on the overt manipulation of tasks, analyze skills to promote higher frequencies of social behavior. Antecedent prompting. This is also called teacher mediation of social interactions. The most typical form of this technique is delivery of an initiation prompt by the teacher, followed by reinforcements. Example, attention or praise to the child with autism for successful engagement in positive social interactions with a peer. Peer initiation. Teaching social competent peers to initiate interactions with individuals with autism, if not only structures interactions between social competent students and those with autism, it also provides additional skill development opportunities for children and youth with autism. Additional information. So in this presentation, I also included the characteristic overview chart. I found this at the Nebraska Autism Spectrum Disorder Network. And it just kind of gives you an idea of what prompting can do. It helps with verbal skills, nonverbal skills, mixed, and the grade levels it can service is pre-kindergarten, elementary, middle, and high school. And as mentioned before, it also helps on every cognitive level, which is classic or high functioning. And the areas it addresses, pre-academic, cognitive, academic, adaptive behavior, daily living, behavior, communication, speech, and social emotional. And the other couple sheets I included were just it's got a prompting diagram, simultaneous prompting, and it just kind of walks you through the process. And then also the prompting diagram least to most just kind of informs you what the least to most prompting requires and what it looks like. And then the other sheet I have on here is prompting implementation checklist. And you can take a look at that. I've included the website, so if you have any questions about that, you can take a look at that. Otherwise, that is the end of my presentation, and here's my reference sheet. Thank you for watching.